Okay. Yeah, same here. Good morning, everyone.
Good morning. How are you?
Good morning.
And how are you?
Welcome
Good to
to
see you all.
Good.
So I'm gonna put my microphone on mute and put
Good morning, all. Good morning, all. Good morning, Edwin. Good
One.
morning, participants. We're having some minor technical issues on the secretariat's end. Please give us 5 more minutes before we begin, and then we'll make the roll call. Hello, Edwin. How are you doing? Good morning again, all. At this time, we'll make the roll call to determine who is in the room. Am I clear to do that, Edwin, on this end, on your end?
Yes, good morning. We're just awaiting Dr. Sotelo.
I'm not sure if you're speaking, but we're not hearing you.
Okay, hold on.
I'm hearing.
Yeah, I'm able to hear you as well, Edwin. Tara here.
Okay.
Oh,
Oh,
right.
I'm
Can you
hearing
hear
you
me?
now.
Okay.
Yes, all right. So I think we're all on board now. So
Dr.
with
Becker,
that,
can you hear me? This is Miss Edwards.
yes,
Yes.
Chair, we can hear you.
And see me? Can you see me as well?
Not at the moment.
Because my Zoom is saying it's not responding, and wait until the program responds. I'm not seeing it clearly. Can the link be resent to me? I've been having problems. I've tried to sign in quite early, but somehow I'm having some problems.
All right, will do. We will circulate the link to you, acknowledging that you are here, and we'll go ahead and start the roll call for all the other delegates. Would that be all right, Chair?
Yes.
Will do. Thank you. So with that, I would begin the roll call by asking if there is any representative of Antigua and Barbuda, the Ministry of Health, Antigua and Barbuda.
Okay.
Any representative from the Bahamas?
Okay.
Is there any representative from Barbados?
Okay.
Is there any representative from Belize?
Dr. Bender?
Yes, thank you.
Yeah, I was informed that it's elections today in Belize and they may not be able to participate. Thank you.
Okay, thank you. So we'll note that. Any representative from Dominica?
Yes, good morning. Vananda Raymond, Senior Administrative Officer. Dominica, and
Mrs. Terry Leah Ravalier. Good morning, everyone. Principal Nursing Officer.
Thank you and welcome. Is there any representative from Grenada? Well, we are aware that the chair was here earlier, Miss Nesta Edwards, who is set to re-sign in once she is able to.
Yes.
Is there any representative from Guyana?
Okay.
Hi,
Thank
good
you.
morning, everyone. Chandraki Prasad from the Ministry of Health, Guyana.
Thank you very much. Is there any representative from Haiti? Is there any representative from Jamaica?
Good morning, everyone. Stephanie Bernard Stevens, Ministry of Health, Jamaica.
Thank you. Welcome. Is there any representative from Montserrat? Is there any representative from St. Kitts and Nevis? Is there any representative from St. Lucia? Is there any representative from St. Vincent and the Grenadines? Is there any representative from Suriname? Is there any
Good
representative?
morning. Good morning, Michelle Williams.
Good morning. Thank you very much. Is there any representative from Trinidad and Tobago?
Good morning, Sherma Alexander Campbell, National Administrator Nursing Services, CNO.
Thank you very much. Is there any representative from Anguilla? From Bermuda? From British Virgin Islands?
Good morning, Jason Tannibal, Chief Nursing Officer.
Thank you very much. Is there any representative from Cayman Islands?
Hi, yes, Kaylin O'Connor, representing Chief Nursing Officer Felicia McLean today.
Thank you. Is there any representative from Curacao? From Turks and Caicos?
Good morning, Linrod Brooks, Director of Health Policy and Planning, Ministry of Health and Human Services.
Jacqueline Sutton, Nursing Officer, Ministry of Health and Human Services, Turks and Caicos.
Thank you very much. Is there any representative from Carrefour?
Good morning, colleagues. Patricia Smith Cummings, representing Carrefour.
Thank you. Well, Edwin, I would hand over to you to introduce the delegation from the PAHO WHO.
Good morning. Sorry for intervening. Just indicating Stacey Goring here from Barbados, Chief Health Planner, Ministry of Health and Wellness.
Thank you very much. This is well noted.
Thank you, Dr. Bender. I'd like to invite our sub-regional program director for the Caribbean, Dr. Juan Manuel Sotelo, to introduce himself.
Good morning, everybody. Greetings from Georgia, Guyana. I am Juan Manuel Sotelo. I'm the Director at Interim of the Sub-Regional Program for PAHO WHO in the Caribbean.
Thank you, Dr. Sotelo. And I'm Edwin Bolastig, HRH Sub-Regional Advisor for the Caribbean. That would be us from PAHO. And I believe we also have a representative from WHO.
Yes, that would be the next person on the list. Is there a representative from WHO?
morning. Hi, good morning, Dr. Bender. Morning, everyone.
Good morning, Ms. Jordan. I'm assuming you are acknowledging your presence on behalf of Barbados.
Yes, I am, as Stacey Goring is also going to join us shortly.
She has already done so. Thank you so much.
Oh, okay.
Okay, and so,
yes,
thank you, Juana Paula. Go ahead.
Hello, good morning. Juana Paula Usamante, Labor Economist, WHO headquarters, and today our colleague Agia is going to be joining also the call.
Thank you very much. Is there any representative from the University of Guyana?
Yes, you
Any
have
representative?
Dr. Cummings from the University of Guyana.
Thank you very much, Dr. Cummins. Is there any representative from the University of the West Indies?
Julie Meeks Gardner from UWI.
Thank you very much. Is there any representative from Dalhousie University?
Good morning. This is Tara Sampali attending on behalf of Dr. Gail Tomlin Murphy from Dalhousie University.
I know there is also another person from Dalhousie University online. All right, with that, I believe Ms. Scamparelli is also from Dalhousie University. Ms. Scampali. I'm sorry if I'm mispronouncing your name.
Yeah, that's
Sorry, that
Tara.
would be me. That would be me, Tara
my
Sampali. Yes, from the Dalhousie
my
University.
apologies. My apologies. I
PAHO
think we had
WHO
two
Collaborating
persons on.
Center. So thank you for the opportunity.
No problem. Thank you very much. And so that leaves the Secretariat. On the part of the Secretariat's end, I will ask the Director to introduce herself. One moment, please.
Okay, good morning. I am Helen Ryan, the Director of Human Development at the Directorate of Human and Social Development. Looking forward to just possibly offering the remarks and leave having a very busy day, but I hope that you have a very fruitful meeting.
Thank you very much. And with us today is also our Program Manager for Health Sector Development, Mr. Mara Bob, as well as Ms. Cheryl Collins, our Administrative Assistant, Ms. Chita Lau, who is also supporting us administratively, and myself, Serena Bender-Pelswick, Deputy Program Manager, Health Sector Development here at the Secretariat. So as it stands, we currently have 6 member states in the room. And so at this point, we do not yet have a quorum. Could we take a few more minutes to allow other persons to enter, another 5 minutes perhaps? And
Dr.
we'll meet.
Benner?
Yes, thanks.
Dr.
Yes,
Benner,
Edwin.
I also would like to express Dr. Benjamin Perez regrets for not being able to, and apologies for not being able to participate during today's meeting due to a competing commitment. And also I'd like to as well acknowledge another colleague, Ms. Lisa Bailey, who's our communications consultant, and I'd like to invite her to introduce herself as well. Lisa?
Good morning. Sorry, everyone, I joined a bit late. Thank you for welcoming me to the meeting. Happy to stay on and listen for as long as I can. Have a great meeting.
Thank you, Lisa.
At this point, we'll just take a few more moments to see if we can make contact with 1 or 2 other member states so that we can begin the meeting. One moment, please.
Dr. Bender, this is Chair. I just want to confirm that you can hear me.
Yes, we can, Chair, and we can see you very well.
You can see me as well. Okay, thank you.
Yes. Edwin, just one request from our end. You should see a participant, EIID. That is a secretariat account from which we're trying to view, join via the boardroom. Okay, I see that we have been admitted. So
Yes, it's been admitted.
on that part, you should put up here. Yes, I see. To see us all in the room at the moment. Yes, and so we'll continue from this view.
Yes, we can see you very clearly.
Okay, Edwin. So we've made contact with a few member states. At this particular time, we're still not curated. However, we will begin the meeting in the interest of time, assuming that they will join later on, and we'll advise them of our progress and seek their concurrence with any decisions made. So at this time, based on the agenda, we would move to have welcome remarks from our Director of Human Development, Ms. Hedge.
Thank you very much, Dr. Bender. Ms. Nesta Edwards, Chair of the Human Resources for Health Caribbean Commission, Dr. Juan Manuel Sotelo, Subregional Program Director ad interim, members of the Commission representing member states, partner agencies, and regional institutions. Good morning. On behalf of the Secretary General of CARICOM, Dr. Carla Barnett, I welcome you to the 8th meeting of the Human Resources for Health Caribbean Commission. Today, you, the members of the Commission, will continue the important work to address issues related to training, recruitment, and retention of human resources for health in the Caribbean community. First, the Secretariat wishes to extend a warm welcome to Ms. Nesta Edwards, this being her first meeting as the new chair of the Commission. We wish you a successful tenure. The Secretariat also wishes to extend thanks to the outgoing chair, Ms. Fernanda Raymond, who has skillfully guided the work of the Commission during her tenure. As this is the first meeting for the year 2025, the Secretariat takes the opportunity to recognize the gains made in the past year. Following the mandate of the Council for Human and Social Development Health, a draft policy brief on the migration and mobility of healthcare in the Caribbean was developed with support from the Pan American Health Organization and WHO. Today, an update will be provided on the outcome of the presentation of that draft policy to COSOD Health at the 47th meeting held in September 2024. In addition, key updates will be provided on the development of the Human Resources for Resilient Health Systems Caribbean Roadmap 2025 to 2030 and the outcomes of the high-level meeting on migration and mobility of healthcare workers in the region of the Americas. Your invaluable input will also be required as the priority areas for 2025 will be considered. The opportunity will be presented for member states to exchange their experiences and chart a unified way forward in addressing common issues in managing human resources for health. In addition, as CARICOM presses forward with the work of ensuring the free movement of its citizens within the community, keen attention should now be placed to the development of policies and not only promote the free movement of persons, of healthcare workers within the Caribbean free market and economy, but emphasize the optimization and harmonization of the education, practice, and regulation of the healthcare professionals that is reflective of the current and emerging needs of the health systems within the region. Member states should also strive to ensure that the safety and well-being of healthcare providers are assured as a means of maintaining a well-equipped and motivated workforce. At this time, I wish to recognize the continued partnership of the team at the Pan American Health Organization and the representatives from partner organizations and institutions providing technical support to the Commission. I wish to acknowledge the focal points from member states that are integrally involved in managing human resources for health and sparing actions to address the challenges faced at the national level. Without you, the work of this Commission would not be possible. We thank you for taking the time out of your schedule, your busy schedule, I must say, to attend this meeting. In parting, I wish you fruitful deliberations in today's meeting. Thank you.
Thank you, Director. And with that, we would hand over to Dr. Sotelo from the Pan American Health Organization to bring remarks.
Thank you, Serena. Mrs. Helen Roger, Director, Human Development, Directorate of Human and Social Development, CARICOM Secretariat. Mrs. Nestor Edwards, Chief Nursing Officer, Grenada, and Chair, Human Resource for Health Caribbean Commission. Dr. Juana Paola Bustamante Izquierdo, Labor Economist from WHO. HRH country focal persons and members of the HRH Caribbean Commission, CARICOM, CARFA, UWI, and BAHO colleagues. Ladies and gentlemen, it is an honor and pleasure to be participating in this 8th meeting of the Human Resources for Health Caribbean Commission. This is my second HRH-CC meeting, so I have been privileged to get a glimpse of the relevant work that this commission has accomplished over the past year. I therefore wish to thank and congratulate the commission for the significant work it has been doing as a collaborative initiative between PAHO, WHO, and CARICOM. During the past year, we saw the development and presentation of a policy brief on migration and mobility of health workers in the Caribbean across various CARICOM bodies, culminating in the presentation to the 47th meeting of the Council for Human and Social Development, COSOT Health, in September 2024. During this meeting, COSOT urged the HRH Caribbean Commission, with support from the CARICOM Secretariat and PAHO WHO, to consider the development of an action plan for interventions to address the migration and mobility of health workers in the Caribbean, based on the recommendations expressed by member states. Welcome the offer by Jamaica, Guyana, and Antigua and Barbuda to collectively explore innovative strategies to improve the retention of healthcare workers, and mandated the CARICOM Secretariat to craft a unified position on the recruitment and retention of HRH. Indeed, migration and mobility of health workers is a major challenge that not just for this region is facing, but the rest of the world as well. But it is important that the voice of the Caribbean is heard on the many platforms for discussion and dialogue on this topic. Hence, the participation of Barbados, Grenada, Guyana, and Jamaica in the high-level meeting on the migration of health workers in the region of the Americas to represent the perspective of source countries and interface with the destination countries in Europe and even within the Americas itself hold much importance. We wish to recognize the strategic and sustainable response of the leadership of Dominica to the nursing shortages that they experienced last year due to the migration of their nurses. Today, we will hear from Principal Nursing Officer Terrila Ravalier about the comprehensive approach taken to strengthen nursing leadership and implement coherent government initiatives to improve adaptability, collaboration, and commitment to quality person-centered care. As we bravely face the challenges of 2025, and as we navigate the increasingly complex global health and political landscape, we remain grounded and steadfast as a region focused on tackling the health priorities of this region. In this meeting, we will discuss the draft Human Resource for Resilient Health Systems Caribbean Roadmap 2025-2030 that is aligned with WHO Global Strategy on HRH Workforce 2030, the PAHO Health Workforce Policy 2030, and the Joint PAHO WHO CARICOM Subregional Cooperation Strategy 2025-2029. We ask you to share your recommendations on the proposed strategic approach to align workforce investment and policy actions to address challenges associated with developing and maintaining HRH for resilient health systems across the Caribbean. Further guiding us in the proposed 2025 work program for the Commission, we will focus also discussed today. We therefore welcome hearing from HRH priorities in each member state for 2025. Let's learn and support each other. We are truly stronger together. To strengthen the HRH Caribbean Commission ability to adapt to evolving HRH needs and its expanding scope of work, we look forward to discussion on updating the terms of reference to align with emerging mandates and realities. Before I close, we wish to thank outgoing HRH Caribbean Commission Chair, Mrs. Veranda Raymond from Dominica for her leadership of the commission last year. And we welcome incoming Chair, Chief Nursing Officer Nestor Edwards from Grenada. We wish you well in your steadfastship of this advisory body. We at PAHO reiterate our appreciation to the members of the Commission and the CARICOM Secretariat for your continued commitment and dedication to work cohesively as a regional technical operational body. Your collective inputs are critical in providing the requisite policy and technical advice to CARICOM for the improvement and development of human resources that promote regional integration as a mechanism that supports and enhances national actions. I bid you a very productive meeting, and I wish you all the success of the rest of the year. Thank you for your attention. Back to you, Serene.
Thank you, Dr. Sotelo. It's much appreciated. Your remarks are well noted, and I think we all recognize that this body has great potential to move forward in the future. With that, we would ask Ms. Nesta Edwards, CNO of Grenada, to assume chairmanship of the meeting.
Thank you, Dr. Bender, and good morning to all. I am Nestor Edwards, the Chief Nursing Officer of Grenada, as well as the Chair of the Regional Nursing Body. I must say that I am indeed grateful for this opportunity to serve as Chair of the Human Resources for Health Caribbean Commission. I take this opportunity to welcome all representatives to this meeting. Over the years, the Human Resource Commission, which has started off as the Human Resource Action Task Force, has done quite a lot of work in the area of human resources, from the development of policy briefs on addressing COVID-19 vaccine hesitancy among health workers in the Caribbean that outline measures to reduce vaccination hesitancy among healthcare workers, interventions to strengthen HRH response to COVID-19 and emerging pandemics in the Caribbean, to policy briefs on migration of health workers in the Caribbean and the revision of the HRH for resilient health systems roadmap in the Caribbean. I would like to commend the past chair, Ms. Veranda Raymond from Dominica, for her leadership during her tenure. And I look forward to working with you in addressing the HRH challenges in each member state. I look forward to your cooperation and indeed very grateful for the opportunity to serve in that capacity. I would now like to call the meeting to order. And moving on to agenda item 4, adoption of the agenda. I will like to invite the meeting to review the draft agenda and advise on any new items to be proposed. So I now invite the meeting to review the agenda, and if there are any new items you would like to see added, please indicate. Okay, if there are no new agenda items, I will like to ask that the agenda be adopted. And two members will be asked. I would like two members from the commission to move that the agenda be adopted as is. Can I have the hands of two persons to adopt the agenda? If there are no new items to be added, you can indicate by raising of hand.
Okay, we know to raise hand.
I'm not seeing, I don't know if anyone has indicated.
We know the raise, yes, Chair. We know the raised hand of Miss Julie Meeks Garner and from Miss Fernanda Raymond, as
Okay,
well as, okay, so yes, the agenda has been adopted.
okay, Miss Julie Mix and Fernanda Raymond. All right, thank you. All right, so we'll now move on to agenda item 5, which deals with procedural matters. The meeting is scheduled for 2 hours from 10 a.m. to 12 midday, Atlantic Standard Time. As it is a virtual meeting, participants will be asked to identify themselves by the country, organization, or institution they are representing, followed by the first and last names. They will indicate the same in the virtual chat upon entry into the meeting. And this will allow us to, restrict persons who are not participants or should not be participants in this meeting from participating. Participants are asked to mute their microphones on entry. And microphone should also be muted when a presenter is on the floor. Each presenter would have 5 minutes to make his or her presentation. And the meeting will be invited to make interventions following each presentation. And as mentioned before, participants will use the raise hand icon on the Zoom platform to indicate their readiness to contribute to the meeting. Okay. So we're moving on to agenda item 6, which deals with proposed 2025 work program for the Human Resource for Health Caribbean Commission. And to make this presentation, I invite it's CARICOM Secretariat, PAHO WHO. I note CARICOM Secretariat and PAHO WHO will be doing this presentation.
Yes, we will be, Chair. So admin will project the list of activities that are being proposed, and we will walk them through together.
Okay, thank you.
Over, Edwin.
Thank you very much, Madam Chair, and thanks as well, Dr. Bender. I just wanted like to confirm if you're seeing the screen.
Yes, we are.
Okay, right. So just to walk you through what are some of the projected activities for this year. The CARICOM Secretariat as well as the PAHO Secretariat have been meeting since last year in order to compile a set of activities that would reflect what are currently being done, what are those for follow-up actions, as well as those that have been identified based on the draft HRH Caribbean Roadmap. And so today we present to you draft work plan for 2025. We will understand as well that, sorry, let me just admit. Okay, right. So we will also understand that some of these activities may require funding, and so it will be subject to availability of the funds as they become available in terms of their implementation. So for January to February, we have edited the HR for Resilient Health Systems Caribbean Roadmap that is for presentation today and for consultations for the rest of the year until we reach approval for publication. And also, currently, there's an ongoing case study on strengthening nursing education in Belize, Dominica, and Turks and Caicos. This is being conducted by a consultant from the University of North Carolina, Chapel Hill, which is our one of our PAHO WHO collaborating centers. They've been involved in the nursing education missions to these 3 countries, and they're in the process of consolidating the findings and recommendations from these missions to put together a case study that would identify recommendations on harmonizing nursing education across the Caribbean. So hopefully that this is going to be completed by end of April, and we will have the report to present in one of our upcoming HRH Caribbean Commission meetings. The next one is the development of a case study on advanced practice registered nurses in Jamaica, including a stakeholder mapping, policy analysis, and mapping of legal instruments regulating the practice of APRNs in the country. And as well, for this one, it's not just to look at the regulatory framework in Jamaica, but also learn lessons that could be adopted and also considered by other countries in the Caribbean as they expand the scope of nursing practice through the advanced practice registered nurses route. The next one is, well, there was supposed to be an HRH mission to the Bahamas, which is indefinitely postponed at this time. And this is to conduct the face-to-face HLMA training and also to conduct the HRH policy and plan for the Bahamas. There have been changes in the timing, so we'll keep you updated on that. The next one as well, we've just developed the terms of reference for the drafting of the report on preliminary lessons from the field towards delineating a competency-based framework for community health workers in the Caribbean. Hopefully with this preliminary study is, we wanted to see the development of a policy brief that would provide recommendations in terms of how we utilize our community health workers in responding to the health needs of the country, particularly in this particular study, looking at NCDs. So for March, we had the 53rd meeting of the Executive Education Committee in which we presented the Caribbean Roadmap for 2025-2030, as I will present later on. Currently, the draft LMA country profiles have been shared back to the HLMA country teams by Sebastian Oleas, who is our HLMA consultant for PAHU, and along with a review from Dr. Juana Paula Bustamante, who's also in the call. Both of them have provided, and also the HLMA unit and WHO and PAHU WHO HQ have provided support in the conduct of a series of webinars last year for the training of HLMA, as well as a face-to-face in-person meeting in June in Trinidad and Tobago last year among 10 countries in the Caribbean. And now the draft country profiles have been shared with the country teams for review. And so we hope that you will, our country teams will review them, and we move towards finalization of these country profiles. So today we're having the HRH Caribbean Commission meeting, wherein again, we will be reviewing one of significant agenda that will be discussed today is the review of the terms of reference of the HRH Caribbean Commission, considering that we're still operating out of the TORs of the Action Task Force. And also for this month, we hope to finalize the terms of reference for the harmonization of midwifery education, training, and regulation in the Caribbean region so that we could move towards identifying a consultant and getting the consultancy on board, at least for the first phase of this consultancy for this year. In April, we hope to develop a policy brief on strengthening the regulatory framework for the advanced practice nursing in Jamaica, as I mentioned earlier, which is the second part of the consultancy. We are contemplating, based on the mandate or decision from COSOD in terms of looking at the retention and migration of health workers, we hope to organize a workshop wherein we could bring together different countries in terms of identification of the pain points, bottlenecks, and gaps in the retention and migration of the health workers towards, with a view towards developing an action plan, hopefully in May, as you can see here. We also would like to look into conducting an HRH education and training needs assessment, as well as the assessment of the interprofessional simulation laboratories in the Caribbean. So moving on, for May, I would have already mentioned the action plan. Hopefully, we could organize a workshop around that, whether virtual or in person will be dependent upon availability of funding. If it's not possible to have face-to-face meeting, then we'll probably have a virtual one. And then we are anticipating that on the 33rd meeting of the Chief Medical Officers that is going to be conducted here in Barbados, the HRH Caribbean Roadmap 2025-2030 will be presented also for review by the meeting of the CMOs. We also would like to have a workshop to develop a research protocol for the development of investment cases for the recruitment and retention of competent and adequate numbers of health workers based on the model of care and health needs. We're hoping to have this conversation with the Health Economics Unit of UE so that we could move towards the conduct of investment cases, subject, of course, to availability of resources to be able to do this study. And hopefully by this time as well, we would have the results from the preliminary lessons from the field towards delineating competency-based framework for community health workers. And we're contemplating on a webinar to disseminate the results of the findings. In June, we are going to be having the UE PAHO practicum for the second cohort. This will be a 2-month internship at the PAHO Barbados office. And this culminates the 2-year diploma in health policy and health systems with University of the West Indies, Cave Hill campus. We are happy to inform you that we are working with the legal department of PAHO in terms of ensuring that the practicum students will be getting stipends given the new policy for internships with PAHO. And so this is an incentive for interested participants from the Caribbean to enroll in this diploma in health policy and health systems, wherein 2 months of the final year is dedicated towards having a practicum at the PAHO Barbados office, and also having mentors from the different PAHO entities. And at the end of the practicum, each student will be able to develop a policy brief of his particular health topic of interest. And we hope to have the 9th HRHCC meeting in June. And hopefully we could organize a workshop to develop the action plan on strengthening strategic information on human resources for health in the Caribbean community. In July, the annual general meeting for the regional nursing body will be held. And also, we hope to conduct a sub-regional dialogue or roundtable policy discussion regarding bilateral agreements, as well as on regular migration pathways. Right at the moment, Jamaica, and I suppose our representative from Jamaica will be speaking about this bilateral agreement later in the meeting. But it would be interesting to actually take a look at these bilateral agreements, monitor them, and see its impact on the protection of health workers and also in strengthening health systems across the Caribbean. In August, we hope to have the 10th HRHCC meeting. And in September, based on the bilateral agreements, we hope to see if we could develop a sub-regional guidance document related to that. And we also anticipate that the preparatory meeting as well as the 49th COSAD Health meeting will be happening in September, where we are going to be presenting the HRH Caribbean roadmap as well as any proposed changes to the TORs of the Caribbean Commission. In October, we hope to, if we are able to conduct some of these investment cases, is to be able to present findings if they've been conducted, and also the validation of the tool and assessment of interprofessional teams around this time. We're very happy to let you know that the tool on interprofessional teams has been piloted in Honduras last week. And so it is on its way for review and being finalized. And once accepted, it's going to be translated into English. And we hope to have the validation and piloting of the English version of this interprofessional teams tool in the Caribbean. In November, we hope to have the 11th HRHCC meeting. And we will, explore the possibility of discussions on the National Health Workforce Registries for competent and practicing staff in the Caribbean. So that ends my presentation, and over to you, Madam Chair.
Thank you, Dr. Bulastik, for your presentation on the work plan, the annual work plan for the HRH Caribbean Commission. I will now invite any feedback, any comments from the meeting members. Do you have any comments, any questions for Dr. Bulastik at this time?
Madam Chair?
You can indicate by raise of hand. I'm not seeing any hands, so I would seek assistance.
Yes, Madam Chair. The hand of Dr. Juana Paula Bustamante from WHO is raised.
Okay, you may proceed, Dr. Juana. You may proceed.
Thank you. Edwin, thank you so much for sharing this list of activities. It's very good to see the whole work projected. Thinking also about the budget and what it means, and also about clearing with the countries and everything. Just 2 comments. I noticed a virtual meeting on bottlenecks on retention and return migration, and also regarding a workshop to develop a research protocol for the investment case for the recruitment and retention. So this is very important, and you know that we have been working with like PAHO and WHO in terms of retention, recruitment, and migration. So there's an ongoing work on that. So it would be great to see how it complements and how it can be even better applied to the region. So I just wanted to bring that topic to the meeting, just for us to have in mind when that moment comes, to link everything, right? Over.
Thank you, Dr. Juana Paula. Dr. Bulastik, will you have any response, or is that clear now?
Yes. Okay, thank you very much for that, Dr. Bustamante. And thank you for your comments. Indeed, these are very ambitious activities that we wanted to do. This came out actually of we submitted a proposal for resource mobilization actually last year, and it would have included it. Unfortunately, given the situation that we're having right now, we did not get that funding proposal. So while it still remains there, we are hopeful and that we will continue to be active in terms of looking for possible to be able to mobilize resources to be able to conduct this studies, considering the cost that it will take. And so I also invite actually members of the HRH Caribbean Commission and other participants in this meeting to help us in the identification of potential sources if they're aware of potential sources of to be mobilized for the work of the HRH Caribbean Commission, then we would greatly appreciate that. So we're being transparent and honest to you that while last year we would have submitted a proposal for resource mobilization, unfortunately, it was not approved due to the so that we continue to be hopeful that once we're able to mobilize resources, that we will pursue these planned activities. Thank you, and over to you.
Okay, thank you, Dr. Bolastic. I acknowledge the hand of Professor Julie Mix. You may proceed with your intervention at this time.
Thank you so much, and thank you so much for presenting the work plan too. This is really excellent, and I agree it's quite ambitious. But was it shared with us already, or will it be shared with us? That's my question. I'd like to pass it on to my other UWI colleagues on this committee.
If I may, Edwin, we will circulate all of the documents post-meeting. So yes, this will be circulated.
Thank you so much.
Okay, thank you. I see the hand of Agia Mahat. You may proceed.
Hello. My question is regarding the subnational guidance on bilateral agreement. What is the scope of this guidance, and how will it be different than the existing WHO guidance on bilateral agreements? Thank you.
Yes, this is still open for deliberation. It's really to look at to look at what is happening in terms of the bilateral agreements in the Caribbean, and to learn lessons from it. And also, of course, it is going to be aligned with the global guidance, and to see what sort of specifications that would be required for the Caribbean to make this bilateral agreement successful, given the realities on the ground. It will certainly be aligned with the global guidance, but it's to look at what specifications are required in order to ensure successful implementation given the realities in the Caribbean.
Okay, thank you. Are there any other comments from members? Okay, if not, once again, I'd like to thank Dr. Bolastic for presenting the proposed 2025 work program for the Human Resource Caribbean Commission. You see, it's a lot of work, but we are committed. I would now like us to move on to agenda item number 7, which has to do with member states' human resources for health priorities for 2025. So I would invite member states to indicate their priorities for 2025.
Here, if I may.
Yes.
Yes, so
Yes, Dr. Benda.
thank you so much. The Secretariat, as well as PAHO WHO, felt it was important for us to appreciate what are the priorities that the member states have for this particular year as it relates to HRH, and of course to determine if there is any cross-cutting area that could potentially be one of interest. But in addition to that, we also felt it was equally important for member states to give an update on initiatives that they were already conducting with support and perhaps in coordination with this particular commission. So if we would suggest that perhaps we could go around by member states who are in the room and just ask them briefly to describe what initiatives they've been currently conducting and their status, and what are their top 5 priorities for 2025. Thank you. Over.
Thank you, Dr. Benders. So we begin with is Antigua and Barbuda. Do you have, can you assist with the list of members in alphabetical order if we are here?
No problem, Chair. Antigua and
Right.
Barbuda is currently not in the room. I think our first member state in order, it would be Barbados. I would invite Barbados to comment at this time. Ms. Jordan, Ms. Goring, I'm not sure if you're hearing us.
Good morning again. My apologies. I was distracted a bit with another conversation internally. Can you restate?
No problem. This agenda item is aimed at determining what are the member state
Yes,
priorities
we
at
are
this time. So
asking member states, we are at agenda item number 7, and we are asking member states to present on the priorities, the top 5 priorities for 2025 as it relates to human resources for health, and any initiatives that they have embarked on in terms of human resources for health, you know, either at the country level or in collaboration with the commission or other agencies.
Okay, could you give me a few minutes and come back to Barbados while I confer with my CNO shortly? Did you hear me?
Chair?
Can you hear me?
Yes, we're hearing you. Chair, with your permission, we'll be move on to the next member state. It appears the chair may be having some technical difficulties. So yes, that is acknowledged. And we would move on then next to that would be Dominica.
Yes, good morning, everyone. This is Mrs. Terry Ravale, the Principal Nursing Officer. Am I being heard?
Yes.
Sure thing.
Thank you so much. Okay, as it relates to the Ministry of Health, priority areas as it relates to human resource, I'm going to list them, but they are not in priority order in that sense. I'm just going to list 5 of our areas, and later in presentation, I do have a presentation as it relates to our activities and achievement, which I will leave for the presentation period. Number 1, it's strengthening our health system resilience, especially as it relates to crisis preparedness, since we are always prone to the major hurricanes and disasters. This is one of our priority areas, our health system resilience. Number 2 is professional development. This is an area we are definitely looking into in terms of developing not just nurses, but the entire human resource personnel on professional development. Another area, 3, is recruitment and retention. It is again across the board for all healthcare professionals. This is an area we are considering. And number 4 is workforce planning and development. We are looking into further exploring our strategic plan as it relates to human resource, and capacity building is within the workforce planning and development area. And very important, this is the one most probably we may have as number 1, but we have not decided yet, is digital health competencies within the healthcare personnel, because pretty soon we are going to have this, the Ministry of Health is going to go e-health. So right now we are doing, or we have already started training as it relates to digital health. So most likely that might be our priority areas, digital health competencies within human resources. That's it. Thank you so very much.
Thank you, Mrs. Ravilia. Dr. Brenda, can you move on to the next state?
Yes, Chair.
Grenada?
Yes, it would be Grenada.
All right. Okay, our priorities are, first, we have regularization of health workers. We have a number of healthcare professionals who have been holding acting appointments for years, and the status has not been regularized for one reason or another. And also we have large numbers of healthcare workers employed on contract, and that has been a sore point for many of them, and also a contributor to migration, because the security of tenure, you know, they're concerned about that. Training is another priority area for us in Grenada, training in specialized areas to meet the healthcare needs of the population. You know, our epidemiological data is showing that cancer is the #1 cause of death in our country. And so, you know, training in oncology is very important for us. The complications of chronic diseases such as kidney failure. So we are training health workers in dialysis, you know, those areas. Retention of health workers is also important for us. And government has started looking at a retention strategy for nurses and doctors in Grenada. They have also implemented incentives for nurses, an extra $500 for every nurse, and the doctors get an extra $1,000 on their salary. There are plans to conduct an HRH audit, which will give us information in terms of actual numbers, skill set, where the gaps are, etc. Succession planning is also important for us, you know, and human resource information system. The digitalization of the healthcare system is for us, is important, is on our priority, and having a human resource information system would help us quite a lot. At present, we do not have a human resource information system. All data are manual, paper-based, and this presents a challenge in terms of getting the data on HRH that we actually need to have to make decisions on HRH. So those are the priority areas for HRH in Grenada. Thank you.
Thank you, Chair. So that would be followed by Guyana.
Good morning, everyone. Chandrauti Prasad here from the Ministry of Health, Guyana. This year, I'm pleased to say that we would have collaborated, or we started the collaboration in terms of having a new strategic plan. And in that plan, heavy focus is placed on human resource needs, retention of healthcare workers, as well as recruitment. This is being done in collaboration with PAHO, and we welcome the support. So that's a plan that would drive us for the next 5 years, and most of our strategic areas would be captured in that plan. Another area of focus for us is training, obviously because of the vast expansion in healthcare services that we'll be providing. This year alone, we are expected to have about 7 new hospitals being commissioned. We need to have staff for all those hospitals, additional staff, that is. So with that, we would have been utilizing the hybrid curriculum approach to delivery. Next month, we are expecting to have 788 nursing assistants who would be graduating from our program. And currently, we have about 1,500 RNs in training. So that would continue to be the focus. And this is an initiative for the RN curriculum that this curriculum review is another area for us. And we are reviewing the RN curriculum. And in that, we will be incorporating into professional teams and how to actually have that whole collaboration happening among different healthcare workers and so on. So curriculum review is high on the agenda for us. We started a little while, but we're hoping to complete that during the course of this year, so we can have that model. They specialized training, because we want to actually give our nurses the opportunity to have other skills as well. So specialized training for our nurses and other categories of healthcare workers, that would be an area of focus. And I had a discussion only yesterday, and I was told that we're having some international partners who would actually assist in this area as well too. The electronic management system, as you know, that we're going digital as well here in Guyana. So this is one of the big projects from the Ministry of Health, so that we would have all our data and our patient flow would be a much smoother process for us in terms of having all the patient data and all of that in one space. The other area that we want to look at would have been the collaboration, obviously, with PAHO to have other projects. But I know at this point in time, too, the support financially, we are all on a little uneasy with that as well, too. But in terms of retention, most of the plans that we would have would be in our strategic plan that we're currently working on. So that's it. I don't know if the HR manager who is here, Ms. Noel, if you want to add anything to that.
I don't believe
Okay.
Noel is online, so perhaps we can move to the next member state.
Yes, we can.
That would be Jamaica.
Good morning, everyone. Can you hear me?
Yes, yes, I
Okay.
can.
All right, so I'm just going to list the priorities as well as the actions that we have already been taken. So one of the priorities for 2025 for Jamaica is, of course, recruitment and retention. Like all the other member states, we're having the issue with our healthcare workers leaving. And so recruitment and retention is a priority. Along the lines of recruitment and retention, we'll have bilateral agreements being looked at, as well as also continued recruitment for those healthcare workers that would have been leaving our training institutions. We have training, as would have mentioned, that we have invested significantly in training. We just offered over $1 billion in scholarship for persons wanting to study healthcare related fields. The implementation of our HRH policy and action plan that is to be finalized soon is also a priority area for us for 2025. That plan is in the late or advanced stages of being developed through a consultancy. We are also looking at our HRH information system. We have secured some funding to initiate the process to develop such a system. So that is something that is going to be at the forefront for 2025. And we also want to conduct a health labor market analysis to inform this HRH system and also to help us with our planning for human resources for health for this year. Thank you.
Thank you, Jamaica. Next country, please, Dr. Bender.
That would be Suriname.
Suriname.
Good morning. Is my voice okay?
Yes, I can hear you.
Okay. Well, I've thought about it, and the priorities for Suriname are first, recruitment and retention, obviously because of the migration, but we have a specific focus on nursing. We are also focusing on training for also the nurses, but in order to fill the shortages in specific areas, in the NICU, the nephrology department. Those types of specialized trainings are necessary in order to keep our healthcare on the same level, or at least try to get back there up again. We're also focusing on dissemination of information on the importance of reporting, because that is a problem when we're supposed to get data not only for our planning but also to report back to WHO PAHO. We're also trying, because of that, the data problem. It's actually not a problem, but okay. We're also trying to work on our HRH planning, strategic plan, but that we're not there yet. So that's it actually for this year. Thank you.
Thank you, Suriname. Next country, please, Dr. Bender. Dr. Bender, can you assist with the next country?
Yes, sorry, I didn't realize my mic was muted. It's Trinidad and Tobago, followed by British Virgin Islands.
All right. So Trinidad and Tobago.
Good morning, Chair.
Morning.
So some of our priorities with regards to HRH for 2025 include working with key stakeholders across the associations. This is for nursing, the regulator, the employers, and the Ministry of Health to identify key challenges and priority areas for improved patient outcomes. We're looking particularly at curriculum review of our Nursing Personnel Act, strengthening the performance of graduate nurses, and looking at different methods to engage the senior nurses as to how they assist with new nurses coming into the system. We're also looking at permanency status of health workers to assist with retention. We're opening new hospitals to improve working conditions for staff. We're looking also at strengthening the capacity of performance through policy formulation and implementation. Another area would be digitalization across all public service providers so that clients can have their health records be seen across all public service providers. And the last two, we're looking at the monitoring of nurse to patient ratio with a view of coming out with a recommended standard for the public sector. And lastly, we're looking at international recruitment of specialist nurses while we're also training locally, but we're also going out to see internationally what that recruitment will look like. So those would be some of our areas for Trinidad and Tobago. Thank you, Chair.
Thank you, Trinidad and Tobago.
British
Next.
Virgin Islands, followed by Cayman Islands.
Okay. So the
Good morning.
BVI.
Yes, thank you, Chair. Good morning, all. Currently, we're doing, I think the biggest one on our agenda is we're doing consultations towards a strategic plan for the health services, and this will guide our operations for the next 5 years or so. It's being done by KPMG, so the consultations are ongoing as we speak. We're also entertaining discussions for an RN program with the H. Lavity Stout Community College. And I must say here that currently we have no training schools for nursing or medicine in the BVI. So we are having initial discussions with the H. Lavity Stout Community College as to how we should go about that. It's a very difficult process, seeing that currently it's a 2-year program. And so to move from a 2-year to the college offers 2-year programs, associate degree programs. And we are adamant that we need a bachelor program. So the discussions are ongoing, but it's a very tedious process. We're also looking at recruitment and retention, and we hope that the strategic plan will guide that. Currently, our nurses, like I said before, we have no training schools, so all our health staff are trained elsewhere, and some are BVI landers and some are not. We're also having a program for the non-regulated personnel in health to improve their competence, caring, and confidence in the delivery of care. So currently we have 20 persons enrolled in that program, and it's a 3.5-month program, at which time they will be care certified is the term that we're using. So we hope to improve their level of service in the health system. I think those are our 3 big things that we're working on currently. Thank you very much. And over.
Thank you, BVI.
This is Cayman Islands, followed by Turks and Caicos.
Hi, good morning. Kaylin O'Connor here, representing from Chief Nursing Officer Felicia McLean, whose apologies she's not here today. She's on official travel for work. However, I will state 3 of our top priorities here for the Ministry of Health as it relates to HRH. As many of the other member states have mentioned, we want to strengthen and improve the retention and recruitment strategies here. And we're doing that through expanding our school health nursing workforce. We have a shortage of school health nurses within our Cayman Islands government schools. So we're currently advocating for additional funding to hire more nurses. And so this will align staffing levels with student health needs, particularly in areas of chronic disease management, mental health, and preventative care. And currently, so with the nurses that we have on island, Chief Nursing Officer Felicia McLean with the Ministry of Health is initiating a research project, the Delphi method, to strengthen the nursing profession, where we identify and address career development barriers. And so it's a structured communication technique where we're experts, including CNO herself, gather a consensus through multiple survey rounds. And so it's engaged to practice registered nurses and midwives in the Cayman Islands, where they do a short survey currently, each round lasting about 5 to 10 minutes, and just collecting demographic data and insights on perceived career development barriers and potential solutions. That's it for Cayman Islands. Over.
Thank you, Cayman.
Turks and Caicos, and then we'd have to circle back to Barbados.
Good morning. Thank you once again. Can you hear me?
Yes, I can.
Okay, great. So for the Turks and Caicos Islands, we have identified 7 priority areas for human resource for health, but for this year, we intend to focus on 4. The first one is strengthening workforce planning and management, and we will do that through conducting comprehensive HRH assessments to determine gaps and future needs, develop a national HRH strategic plan that aligns with our healthcare priorities. Last year, we launched our national health strategic plan, and so this plan will be coming out of that plan. Enhancing workforce data collection and analysis for evidence-based decision-making. Our second priority area is capacity building and continuous professional development, expanding training programs for doctors, nurses, laboratory technicians, and public health professionals. As you would know, our R&B colleagues and Dr. Ballistic, is that we have commenced our registered nursing program at the associate's degree level, and we're working with the community college to expand and move to the bachelor's degree in nursing. Hopefully, we will be able to accomplish that in September 2025. Implementing structured continued education and upskilling opportunities for those nurses, for our nurses to be registered and licensed to practice. They are required to have continued nursing education. Also for our doctors and all of even our allied health professionals. And so we want to strengthen and structure our continued education program, and strengthening partnerships with regional and international training institutions. And number 3, strengthening primary healthcare workforce, increasing the number of community health workers to improve access to essential services. We believe they are key in helping us to work in our community, and training healthcare providers in integrated patient-centered care, expanding multi-delivery disciplinary teams, for holistic health service delivery. And the 4th one, but by no means least, increasing recruitment and retention of healthcare professionals. In 2023, the Turks and Caicos Islands government did a salary review and upgrade for the government workers. And nurses were placed in a special salary scale. Actually, all healthcare workers was placed in a special salary scale. So we want to expand incentives for attracting and retaining skilled healthcare workers, especially in underserved areas, offering competitive salaries, benefits, and career development opportunities, strengthening recruitment of specialized professionals in fields such as epidemiology, mental health, and primary care. Thank you very much, Madam Chair.
Thank you very much, TCI, Turks and Caicos. Dr.
So,
Benda, we go back to Barbados.
yes, Chair, but I also want to alert that I note that St. Lucia's in the room.
Okay.
Miss, so I don't know if they'd also want to chime in following Barbados.
All right, so at this time we invite Barbados and then we'll take on St. Lucia.
Thank you. Okay, so for the specific areas for Barbados for focus, the first area we are going to focus on is we are currently developing a human resources, a strategic plan for nursing, and we want to place emphasis on recruitment and retention of nurses, and we're also going to be paying special attention to the education of nurses as it relates to advanced nursing. We've also highlighted the priority to explore South-South collaboration with other international organizations to address the deficits in specialist areas, particularly in orthopedics and kidney disease. The third area of priority we also want to look at is training in special areas such as speech therapy, occupational therapy, and physiotherapy. I also want to add that we are also looking at reviewing our management structure of our primary care system. And part of that process will be identifying the appropriate human resources to ensure that that management structure is fit for purpose and that it executes the work that we have planned. So those are the initial areas for focus for Barbados at this time.
Thank you, Barbados. St. Lucia.
Good morning. Thank you, Chair. Okay, for St. Lucia, our priority areas would be number one, we're looking at recruitment and retention of healthcare workers, and specifically, we're looking at nurses and pharmacists, which are our two areas of greatest shortage right now. And we have developed a recruitment and retention plan, which will be going to cabinet next week. But this plan is focused on increasing production of local nurses, as well as benefits and incentives for our current nurses. Secondly, we're looking at professional development and capacity building in various specializations. So priority for us would be oncology, nephrology, public health, management and leadership in nursing, and also in healthcare. And also looking at the development of a mentoring program for novice for transition from school into the workplace. We also will be focusing on information technology, and we're looking at improvements in human resources, a database, and that would be specifically to assist with planning and forecasting of healthcare workers, and also to assist with the state of the world's nursing and midwifery reports, which we are supposed to be reporting on. Currently, we have a paper base. We're hoping to go digital. Fourthly, we're looking at the development of a strategic plan for nursing. So we're hoping that this is an area that we can focus on this year, especially because we do have limitations that relates to nursing. And lastly, from January, we've been focusing or giving priority to mental wellness initiatives, and that is a project funded by CDB. So it's implementation of mental health initiatives to assist healthcare workers with coping strategies and also with building resilience. Post-COVID-19, we realized that quite a few persons were affected, and now that we've gone back to normalcy, we're trying now to assist persons with coping with the different issues that may have arisen during COVID. So there will be a few mental health strategies that will be, or programs implemented throughout the year, specifically aimed at nurses and doctors. However, it will be extended to all healthcare workers who would have been affected and persons who would have been working on the forefronts during COVID. So basically, these are our priority areas for 2025. Thank you very much, Chair.
Thank you, St. Lucia. So, Dr. Benda, I think we cover all the member states
I
represented.
believe so, even though I noted there was a comment in the chat that St. Vincent may be in the room. Just to confirm, even though we're not able to see any representative on the line at the moment, is there a representative of St. Vincent in the room?
Good morning, Wilma Ryan, St. Vincent.
Okay, good morning, Ms. Ryan. You may proceed outlining St. Vincent and the Grenadines HRH priorities for 2025.
Well, what I'll share is just a few that I can recollect at this time. For us, we are focusing on the retention of healthcare workers and an incentive for midwives. Our government has started that process of the incentives for midwives, where all midwives were given $500 non-taxed on their salary. Also, because of the coming of our Annisville Acute Center, which is scheduled to finish in 2027, in collaboration with PAHO, we had started consultations with Dr. Andy and Marissa George in that aspect where we can have training and involvement of technical working group that involves all stakeholders, including Ministry of Education, Finance, the Service Commissions, the Ministry of Health, so that we can have a buy-in. Everybody will be on par, know what it's about, and have a collaboration with everybody in that aspect. We're looking at training our physician in the specialty areas because the Annisville Acute Health facility will need new staffing, and we have to look in that aspect. Also, the governance and training regulations, and this is under the CDB project. Those are some of our few priorities that we're looking at in terms of HRH. And after having consultations with Dr. Andy, we're able to establish an HRH team or unit per se in that aspect where we can go forward and look deeper into the aspect of HRH and as it affects health and our country as a whole. Thank you.
Thank you, Ms. Ryan, for your presentation. I'm mindful of the time.
Yes, Chair. That completes all member states.
Right. So we'll move on to agenda item number 8, which deals with revision of the HRH Caribbean Commission terms of reference. Now, in 2022, the HRH Action Task Force was established as a permanent commission. However, its terms of reference has not been updated to reflect the widening scope of HRH issues that will now be addressed by the commission, as well as some operational aspects. I will now invite the representative from CARICOM and PAHO to give some key features in terms of what are the areas from that TUR that was developed for the Action Task Force that we need to look at in view of reviewing the whole, terms of reference. So I'll now invite PAHO, CARICOM.
Thank you, Chair. I will raise the presentation and I'll, again, mindful of the time, I'll try to go through this as quickly as possible and I'll ask my colleagues to chime in if there's anything they would like to add. Please let me know if you can see the presentation.
Yes, I can see.
Okay, just a brief review, just noting that the genesis of this particular body started with it being an action task force, which came out of a decision of the 3rd to 9th COSAD, which is the Council for Human and Social Development, and that was in 2020. It was fully established in April of 2021 when those terms of references were developed to govern the work or guide the work of the task force. But the task force served as a mechanism to support the development of policy for strengthening and protection of human resources for health in the Caribbean. And the duration of that initial task force was for 2 years, from 2021 to 2023. It was considered a regional technical operational body, and as such, in the realm of CARICOM, it would be an advisory body more or less to the COSAD on HRH matters, and it did specialize in the development of human resources for health talent in health, and it advised and presented proposals for resolutions and initiatives to CARICOM for the improvement and development of human resources that promote regional integration as a mechanism that favors and enhances national actions. Now, the objectives were to provide technical advice to the CARICOM member states in monitoring the progress of HRH development policies at the national and sub-regional levels, to support the execution of strategic results related to development of the HRH established in the regional framework, which was the Caribbean Cooperation for Health Phase 4, the HRH Caribbean Roadmap, the Plan of Action, and any other CARICOM resolutions, and to promote actions that would allow the linkage between the education, health, workforce, finance, and science and technology sectors as a crossroad. So again, following 2023, on the expiration of the term of the Action Task Force, at the 23rd meeting of the COSAD, considering the ongoing activities that they had, and its usefulness in terms of development of strengthening policies towards health emergencies and addressing vaccination hesitancy of healthcare workers at the time, the COSAB mandated that this action task force be established as a permanent body. However, since its establishment, the terms of reference that we currently still operate under are termed under the Action Task Force. And now revision is required to reflect the current status of the body as a full-fledged commission. So even the basic nature of the terms of reference being that for the Action Task Force would be have to update it to reflect it as a commission. So the potential areas of review really are circulating or surrounded the scope of work of and responsibilities of the body. Now that COVID-19 is no longer an international health emergency, we do have to review some of the scope and responsibilities as in the initial task force terms of reference, activities are heavily skewed towards that. And so is there room to reconsider or restructure those activities to make it more open-ended now that the COVID-19 pandemic is over? In addition, we do have a few emerging issues in the region as it relates to human resources for health and whether it is that the commission would also consider those in their scope. So that would be for the consideration of the membership. And again, given the coalescing priority areas that may be identified. In terms of the composition of the body itself, there's also need to reconsider that. At this time, membership usually will include a substantive and alternate representative or focal point from member and associate member states, as well as the inclusion of other members which are captured as our institutions, organizations, and programs that exist within the framework of the task force. So that would be our universities, the CARAFOL, PAHO itself, which also acts as the executive secretariat in coordination with the CARICOM Secretariat. But there has been posed a question as to whether there should be consideration of other states who may not be a part of CARICOM as observer members of the group. And these would include the Caribbean island states of Bonaire, of the Netherlands, which include Bonaire, Aruba, Curacao is already a part of CARICOM, but also Saint Eustache and Savo, as well as French territories within the region. And this is in consideration of the fact that they are part of the PAHO member state set, are participating members in the PAHO organization, and therefore it is felt that it may be beneficial to have them participate in this particular commission. However, consideration does need to be given to the fact that this is a CARICOM advisory body up to this point, it being established as a mandate from the COSAD, and therefore their participation would need to be approved by the COSAD. So the operational procedures, indeed, there is need to concretize or formalize some of the arrangements in keeping with other bodies, advisory bodies of the Caribbean community. And as such, some key examples would be one, the key areas that would be addressed, the frequency of the meetings. We currently conduct them quarterly. The modality of meetings, the terms of reference does make provisions for both virtual and in-person meetings. And if it is the intent to move towards formal in-person meetings annually. That is to be determined by the membership, as well as other operational aspects in terms of documentation, as well as the implementation of decisions. Currently, while we do speak to the items in other bodies of the community of this nature, they usually tend to formalize decisions where member states would have to review formal decisions, which would be used as the base to take forward to the COSAD for any further approval. So that structure just does have to be regularized in some way. And that is, again, for the consideration of the membership. So these are some of the potential areas for review that we have identified. But of course, as you review it, other things may come up. And again, just to reemphasize that all approvals will have to be approved by the COSAD before they are implemented. And with that, I want to give you an example, which will be put forward as the decision for this particular activity as well. And again, this is the format that decisions coming out of other bodies of a similar nature would have, where the meeting would be invited to consider some predefined decisions and which could be adopted as is or adapted by membership during the course of discussions. And for this one, it's proposed that the membership note the presentation on the need for the revision of the terms of reference, consider potential areas of review, agree to complete the revision of the terms of reference to reflect the current status of the body as a commission in advance of the next regular meeting of the COSAD Health, and also agree to present the revised terms of reference to the COSAD for approval at its next regular meeting scheduled for 2025. And with that, Chair, I hand over for discussion by membership.
Thank you, Dr. Bender, for the presentation on the review of the TOR for the commission. I now invite any comments that members might have. I see Dr. Emmanuel comments, your hand, you may proceed.
Thank you very much, Chair, for giving me the opportunity. Let's give some free comments. Let me first of all thank all the member states for the presentation in terms of their update as we address this critical issue of human resources for health. Now, I'm coming from an academic institution, and I just wanted to wonder whether, and I did say this at the very first meeting that we have had, that we speak about human resources for health, but our emphasis seems to be focused on one particular profession. I can recall at the very first meeting that I attended, I spoke about we need to widen the scope. Healthcare is no longer about the doctor and the nurse. And I'm going to repeat it again. Medical rehabilitation, that profession is growing. And I believe that apart from migration and all of those things which are captured, the challenges we have, but at the same time, we have to create with the academic institutions. You have the University of West India, University of Guyana, and all the institutions. We need to put in where there is some sort of collaboration to provide the appropriate training provide the outside of those professions that we keep mentioning all the time, other professions that are critical if we are to achieve universal health coverage, because that is our goal, right? Our goal, human resources for health, and it's an important component of UHC. And so I just wanted to see if that can be a major consideration during our discussion. I'm from the university, so I mean our job is to prepare human resources, and we are ready and available to provide all the skills that are necessary. Well, I just want to emphasize again medical rehabilitation, which is critical. We talk about chronic diseases, training and all of that, but holistic care, team building. The other point I just wish to make is about accreditation. I know years ago we used to speak about accreditation. We no longer speak about that, but I think that is something that we need to put back on the front burner, ensuring that that institutions, health institutions and I know CAMHP, CAMHP is a creature of CARICOM, right? And just to bring that back into the discussion, I can recall we had suggested sometime, I think it was 2023, that all programs across, that is in medicine, should be accredited by 2023. They're not, we're in 2025. Let's get a status update as to where we are with that. And also to look at the accreditation of other programs as well. Because one of the things is free movement, right? That's part of our discussions, right? Free movement across the region. And unless we continue to provide the support to the accreditation authorities to ensure that they can expand and get outside of medicine, but also look at other programs to ensure that they are accredited. I know as part of the revised Treaty of Triagaramas that we have accreditation councils in the respective countries, but that does not provide recognition for the professional programs. Thank you very much.
Thank you, Dr. Cummins, for your interventions there. Are there any other comments?
Yes, Julie Meeks
Okay,
here.
Professor Julie Meeks, you may go ahead.
Thank you very much. Also thanking Dr. Cummings for his intervention, but I wanted to ask a question about the invitation of other non-CARICOM countries to sit. Would it be that we would be inviting them, or should there be interest, we would have the capacity to include them? I'm just wondering how it works.
Okay, Dr. Bender, would you like to respond?
Yes, so the proposal is that the outside of member states, or rather member states that are other than CARICOM, which currently sit, would be included as observers, meaning that they would be able to participate in the discussion, but may not be part of the decision-making process. And I don't know if Edwin, if you want to add anything here to this particular query.
Sorry, I wasn't clear. I'm just wondering why that would be up for discussion at all. I mean, why would there be an objection to that?
Oh, why there would be an objection to it? It is rather not an objection, but rather the nature, the formalization of it. Again, because the French and Netherlands territories do not necessarily form part of CARICOM. This being a CARICOM body, it may require approval from the COSAD for their participation.
Okay, that's much clearer.
So it's
Thank you
more of
so
a
much.
formality. So if it is the view in the revision of the terms of reference that that is something that the membership of this particular commission would consider amenable, it would be something that you'd advance to the COSAD to approve. And when I see you want to comment.
Yes,
yes, you may.
Yes, thank you, Madam Chair. Just very quickly, just to respond, we're just trying to kind of bridge the gap between the list of member states and territories under CARICOM and those that are members of PAHO member states, as well as the participating countries, that fall under France and the Dutch Dutch islands. So that while in our previous consultations with these countries, they wanted to take on like a Caribbean approach to the way their health systems are configured, and also in terms of their approach to HRH. However, they're currently not under CARICOM, and so if we are to broaden, the reach of the commission to all of the PAHO associate members and member state, PAHO associate members and participating countries apart from just the member states that are common to both organizations, that we would want to include them as observers as well. So that's the rationale. Over to you.
Okay, thank you, Dr. Bolastic, for this clarity. At this time, we'll move on to agenda item number 9, which deals with an update on the current activities of the HRH. Dr. Bolastic will invite you to give an update on the outcome of the presentation of the draft policy on migration and mobility of health workers in the Caribbean.
Yes, thank you, Madam Chair. Let me just, please give me a couple of minutes to bring up the slides. I'm not sure if you're seeing the.
Yes, I can see.
Okay. Are you seeing the full screen?
Mm-hmm.
The slideshow, no?
No, I don't think it's in presentation mode.
Okay, let me.
Mm-hmm.
Are you seeing it in presentation mode or?
Mm-hmm.
No, okay.
No, we're seeing it in your.
Let me swap.
You have to switch there you go.
Yes.
Yeah. All right. So this is going to be brief. This is just to update on the policy brief on the migration and mobility of health workers in the Caribbean that has been presented to COSOD on September 27th, 2024. As you know very well, it includes 6 strategic interventions, strategic planning and forecasting of health workers through effective collection, utilization, and reporting of data, implementing competitive salaries, benefits, and career growth opportunities as part of improving working conditions. That would include also enhancing job satisfaction and promoting mental health and well-being. Another intervention there was strengthening training programs to include micro-credentials, interprofessional training, and establishing learning pathways. The other 2 interventions were promoting return migration, in a multi-sectoral approach that would include education, labor, finance, and other sectors, as well as establishing regional and international collaboration, including bilateral agreements. So this has gone through a process of consultation from the regional nursing body to the HRH Caribbean Commission, to the meeting of the chief medical officers, and on to COSOD. Now at COSOD, there have been several decisions that we need to be informed about, as it would require intervention and implementation from the HRH Caribbean Commission, and so and as well as the member states that are represented in this body. And I just would like to highlight the ones with the blue arrows. One is urging member states to support data-driven decision-making, ethical recruitment practices, bilateral agreements, and multi-sectoral approaches, and sustained investment in health, workforce, and health systems. Also urge the Human Resources for Health Caribbean Commission, with support from CARICOM Secretariat and PAHO WHO, to consider the development of an action plan for interventions to address the migration and mobility of health workers in the Caribbean based on the recommendations proffered by member states. And so this is where this item has been included in the work plan, and we hope to work on this. The next one is it welcomes the offer by Jamaica, Guyana, Antigua and Barbuda. This is wherein the ministers of health of these countries have shared their strategies in terms of improving the retention of health workers, and so they've been asked to lead the process and the collective exploration of innovative strategies to improve retention in the Caribbean for health workers. And last is mandated the CARICOM Secretariat to craft a unified draft position on the recruitment and retention of HRH. And yeah, and so the meeting is being invited to note the presentation and the updates of the policy brief and decisions from COSOD Health, to consider the integration of the actions required by COSOD in the HRH Caribbean Commission Work Plan for 2025, identify steps to carry out the implementation of the required actions, and agree to the creation of subcommittees that will be tasked to carry out the deliverables.
Thank you, Dr. Bulasik, for the presentation. And I now invite feedback from member states. I note that the COSOR requested the development of action plans. So by the commission, you know,
Yes,
so
that's correct, Madam Chair.
yes, so I'm thinking that the commission would maybe have subcommittees or meet to develop that action plan, you know. All right. Okay, if there are no feedback, once again, thank you, Dr. Bulasik, and the meeting note, the decisions coming out from the COSA. I will now move on to agenda item. We have a 9.2, which has to do with the progress on the revision of the human resources for resilient health system. That's the Caribbean Roadmap 2025 to 2030. And Dr. Bulasik, again, I'll ask that you make that presentation.
Yes, thank you very much. Mindful of the time, I will have to run through this very quickly.
Yes.
Okay, let me just swap. Are you seeing the full screen or no?
Not the full.
Not the presentation mode. Okay. Let me.
Okay. I think.
Are you seeing the?
Yes, I'm seeing it now.
The full in presentation
In
mode.
presentation mode.
Okay, great. Thank you. Okay, so thank you for Madam Chair. At this time, I'm going to be presenting on agenda item number 9.2 on updates on the draft Human Resources for Resilient Health Systems Caribbean Roadmap 2025-2030. Just to show you the outline, it's gonna the alignment with global, regional, and sub-regional mandates, objectives, situation analysis, what have been identified as priorities for 2025, 2030, and the roadmap timelines. So we know very well that the Caribbean has been faced with a lot of HRH challenges that hamper access to quality services for the entire population. So therefore, the Human Resources for Resilient Health Systems Caribbean Roadmap provides a strategic approach to align workforce investments and policy actions to address challenges associated with developing and maintaining HRH for resilient health systems across the Caribbean. I'm showing here alignment with the.
I'm sorry, Dr. Bulasik, I'm not seeing the slides moving. I'm just saying, I don't know if that's the same for the other members.
Let me. Right. Are you seeing the full screen this time? The presentation mode?
Yes, I'm seeing it now.
Okay.
Yes.
So as I was saying, this Caribbean roadmap is aligned with the Global Workforce 2030 policy that has 4 objectives: optimize existing workforce, anticipate alignment investments and future workforce requirements, strengthen individual and institutional capacity, and strengthening data evidence and knowledge. It is also very well aligned with the Health Workforce Policy 2030 of PAHO on strengthening human resources for health to achieve resilient health systems. In fact, the workshop in June in Trinidad agreed to aligning very closely the Caribbean roadmap with these lines of action, agreed by the PAHO member states. Also, this is very well aligned with the draft joint PAHO-WHO CARICOM Sub-Regional Cooperation Strategy 2025-2029, wherein you will see strategic priority number 1, enhancing resilience of primary healthcare-based health systems. And under this is strategic deliverable 1.2 that speaks to supporting the development of workforce policies, plans, and training programs to enhance recruitment, retention, and rationalization of skills mix to ensure a resilient health workforce that can adapt to future health needs. And there was also agreement in that workshop in June that the same priorities that have been identified during the 2018-2022 roadmap, they're going to be retained. So the objective of the exercise was to identify ongoing and new priority HRH areas for the Caribbean sub-region that are aligned with the national, regional, global mandates, and also outline strategic interventions to address challenges under each priority with corresponding milestones, indicators, enabling factors for successful implementation. So as part of the preparation for the development of the roadmap, we did a situational analysis, which is online from June 4 to 7, wherein 35 participants from 16 Caribbean countries and territories participated. We found out that while 71% knew of the 2018-22 roadmap, only 23% of them were aware that the previous roadmap was used to develop HRH policies. This is particularly reflective in the number of countries that actually developed HRH policies and plans. So you will see here the number of countries and the range of participation from the permanent secretary down to the presidents of professional societies. So this is a wide and broad consultation across 16 Caribbean countries and territories. So it's just a snapshot of the situational analysis in terms of governance and leadership. Most countries do not have HRH plans, policies, and multi-sectoral HRH committees. And the locus of responsibility for HRH planning is highly variable from the top level of Ministry of Health and maybe even outside of the Ministry of Health, like the Ministry of Public Administration or Public Service. And then in terms of education and training, countries have competency-based curricula offered by accredited institutions. About 70% of them confirmed this. 37% of the respondents mentioned interprofessional approaches in their curriculum, and about half saying there's social accountability orientation in the curricula offered by these institutions. The next one is access with quality and equity, with 90% having indicated policies on ethical practice of health professionals. About 64% were aware of health ethics committees, and 69% invoke the implementation of chronic care model based on the primary healthcare approach. Sorry. In terms of financing, only 28% of respondents were aware that the HRH plans were the HRH plans have dedicated budgets, and 47% knew of initiatives to mobilize resources. For HRH information systems, only a third of the respondents indicated having some kind of information system for human resources, whether manual, electronic, or hybrid, but half of them indicated wanting to develop its information system for HRH. In terms of research, only 11% of respondents were aware of a national health research agenda that included research on HRH. A third was aware of a national health research unit, but only 5% were aware of a national health research council. And in terms of workforce feminization and gender responsiveness, 40% were aware of a national gender policy. About 25% observed a gender perspective incorporated in HRH planning, development, employment, and deployment in their countries. So moving on now to the HR for Resilient Health Systems Caribbean Roadmap. This was participated in by a total of over 70 participants from 18 countries through in-person and blended and virtual means. And so a number of you from this committee have actually participated in the process. And so you will see here the 5 lines of action, which include strengthening governance and stewardship of human resources for health through appropriate tailored models and mechanisms, establishing consolidated regulatory frameworks and mechanisms for education and HRH practice, establishing and strengthening interprofessional teams and their integration into health service networks based on the primary healthcare approach, enhancing workforce capability and capacity building with focus on primary healthcare approach, including public health emergency and disaster preparedness and response, and ensuring adequate supply and retention of competent fit-for-purpose HRH through financing, regulation, and promotion of decent working conditions, respecting equity, diversity, and inclusiveness, and the protection of the rights of health workers. So under line of action 1, it involves advocacy for cross-sectoral HRH governance at the level of the HRH Caribbean Commission and also at the country level, the development of mechanisms for institutionalizing HRH with budgeted resources, the conduct of situational analysis using tools such as HLMA, APHF, and also the promotion of HRH policy development, workforce planning and implementation, enhancing HRH leadership and management skills, and improving workforce data collection and strengthening of HRH information systems. Line of action 2 entails the development of a regulatory framework with registration and continuous professional education, having a regional collaborative body for accreditation. Dr. Cummings, this is very well, your comment is very well taken, and in fact, it's been considered as one of the strategies under the line of action 2, and development of HRH competencies by having a platform for the sharing of best practices, and also advancing teaching methods that are innovative and are evidence-based. Moving on. Line of action 3, strengthen coordinated work between education and health sectors to promote interprofessional practice, designing competency-based health professionals education, strengthening partnerships, having clear policies and guidelines that support interprofessional teams, developing and monitoring evaluation frameworks for interprofessional teams, and establishing interprofessional teams based on models of care. Line of action 4 is the conduct of HRH education training needs assessment, the design of capacity building training plans based on needs, building HRH capacity to address public health emergency and disaster preparedness, development of continuing education initiatives linked to regulation, accreditation, and relicensing of personnel, developing micro-credential programs, and promoting the use of telemedicine and other innovative e-health initiatives. And finally, for line of action 5, promoting the well-being of health workers and their working conditions, including occupational health and safety, developing regulatory and legislative frameworks, engaging a civil service system to ensure a fit-for-purpose health workforce, incorporating diversity, equity, and inclusion into employment policies and training programs, managing migration through the enforcement of the WHO Global Code of Practice, and the promotion of return migration through appropriate government and regulatory mechanisms. And in the document that is going to be shared, the full document, that was actually shared for review, it will show you a whole matrix that would outline the whole roadmap that would show the lines of action, the identified strategic interventions, milestones, indicators, and enabling factors. You will also see a summary of the roadmap implementation from 2025 to 2030. And finally, what are key points for national implementation is the adoption and implement evidence-based health workforce policies and plans that will build upon the successes and gains from the implementation of the previous plan, strengthening the content and implementation of HRH policies that ensures consistency and coherence among the health, education, employment, gender, migration, development, cooperation, and fiscal policies. Building planning capacity to improve HRH policy and strategies, looking at workforce needs, demands, and supply under different future scenarios, catalyzing multi-sectoral action on the health workforce, and strengthening HRH information systems with broader health health management information system that is linked to that. And then, so what are the next steps? It's already been presented to the regional nursing body and awaiting feedback from the RNB. Then it has been presented today, and hopefully the meeting in May, for the chief medical officers. We'll also be presenting it for consultation as well. And finally, we hope to be able to present the final version to COSOD in September. And once finalized, we hope to proceed with the layout, editing, and publication of the roadmap. I do have a video here, but it will take some time, like 2 minutes. So I'll just skip that and just share the link to the video with you. Sorry, let me move on. So action required, the meeting is invited to acknowledge the need for a strategic approach to align workforce investments and policy actions to address challenges associated with developing and maintaining HR for resilient health systems across the Caribbean. Receive the presentation on the roadmap, review and provide feedback on existing content of the roadmap, and also to agree to present the revised roadmap to the meeting of the chief officers at its next regular meeting in May. Over to you, Madam Chair.
Thank you, Dr. Bolastic, for the presentation on the HRH roadmap. Are there any comments, any burning comment from the members present on the presentation? Dr. Cummins, I see your hand. You may proceed.
Yes, thank you very much. I'm very impressed with the presentation. I think if 2025, 2030, in keeping with the SDGs, I think this is awesome. Let me congratulate PAHO for this Dr. Blastic for this presentation. And my only comment is to urge member states to ensure that we physically redesign our primary healthcare facilities so that this model here can fit into our structures, particularly in the issue of interprofessional. You know, at the university, we are promoting interprofessional training. We want the doctors, the nurses, the pharmacists, all of them to be trained together, understand each other as students. So when they go into the workforce, it will be a continuing interprofessional practice. Thank you very much.
Thank you, Dr. Cummins. And the R&B will review and provide feedback on the roadmap. All right, so if there are no other comments, we'll move on to the next presentation. I know we are way over 12 noon, and I want to ask your indulgence so we can, if it's 12 p.m., if we can go up to 12:30, just to finish the agenda item. Is that okay for members? Yeah? Okay. All right.
Yeah.
So, we'll move on to agenda item number 10, which has to do with the overview of the CARICOM Single Registration of Professional Act, and that will be presented by the CARICOM Secretariat, Dr. Bender.
Thank you, Chair. Please let me know if you can see the screen.
Yes, we can see.
Yes, acknowledging the time frame, I'll do my best to keep this presentation as brief as possible. So just to advise, and I think we're all familiar with the integration of professionals market within the Caribbean single market and economy, for which we have 11 participating members at the moment, which are listed at the bottom of the slide. But appreciating that this mechanism exists, what we're currently moving towards is ensuring that there is a regional regulatory framework for the provision of professional services, which ought to be harmonized. And so the current situation is that while professionals within key areas are regulated among member states, not all of them are, and not all member states do it for all professionals in the same way. And therefore, there is need to harmonize how that is done. Now, in 2013, the Council for Trade and Economic Development, whose responsibility this lays with, approved the regional policy framework on the provision of professional services in the Caribbean single market and economy. And we refer to it hereafter now as the policy. And this was actually approved where member states acknowledge the content of this document. And so the policy inter alia covers what is defined as a professional within the framework of the free market and economy. It speaks to mandating the member states to regulate their professionals operating within their jurisdiction, establish an independent regulator to regulate each professional category, and to separate registration from licensing, i.e. the process of you being recognized within your profession versus your ability to practice that profession within the jurisdiction. It also mandates that the professionals be registered and licensed in order to practice, mandates that all member states facilitate the single registration of professionals, and mandates that all member states establish an independent disciplinary committee where these are subject to common disciplinary measures, and further mandates that all member states work within the common framework for offenses and penalties. So what is being done to, as they would say, codify this? In essence, what is the legal framework that allows member states to implement this? And before I move forward, I just want to highlight the professions under which were recognized in that specific document. And if you notice in blue, the healthcare sector has quite a few categories, and it seems to be the bulk of the areas of focus. So we have the medical and dental professionals, the veterinary service professionals, the services provided by midwives, nurses, and paramedical professionals, which I think in some member states are referred to as allied health professionals, as well as services provided by pharmacists. So these are the categories that are outlined in the policy. Now, in order to enact the policies uniformly across the region, there are two pieces of legislation that are currently being developed within the framework of the Caribbean community. The first is a draft professionals bill, which seeks to assist member states to regulate professions that are not currently regulated, and also seeks to enable member states to strengthen and align their current frameworks. And then the second, of which is of more interest to this body, is the current initiative, which is the Draft Caribbean Community Single Registration of Professionals Act, where the intent of this act is to operationalize Part C of the policy, which speaks to the single registration of professionals within the community. And therefore, what are the procedures that would allow for that, and how would that be implemented? And based on initially, this was supposed to have been operationalized in March, by March 31st of last year. However, work is ongoing, and at its 14th meeting held on January 25 and the 10th of February 2025, the advisory committee to the COTED that is overseeing this particular initiative identified the following categories as the categories that would be implementing the policy in the first phase. And if you note again under number 3, doctors, dentists, veterinarians, nurses, midwives, and pharmacists were identified as the cohort that they would want to move forward. Again, simply because as it stands in most member states, if not all, these categories of professionals are regulated to some extent, even though the regulation may vary from territory to territory. Now, the policy itself, while it has been a challenging exercise for many professions, is expected to be less so for healthcare professions, especially for nurses and midwives, given that these professions are already regulated. However, the readiness of member states to implement all of the provisions within the policy is to be determined and is being determined by that group. And this is being done through a series of consultations with member states. The objective really is to determine what are the commonalities and where there's a decision, or rather a group of criteria that can be developed that would address the various aspects of the single registration program. Now, what is keen to note, and the questions that we've had before, is that if a member state has a system in place or legislation in place that would be superior to the one that would be developed in the Caribbean community, then they do not have to take any further action. But for those member states whose regulations do not align strictly with the bill that would be developed, they would have to work to change that. And so, again, the actions that are required from the group that we're asking is for you to note the overview provided on the implementation of the Caribbean Single Registration Act. Also note the Regional Services Project Steering Committee has recommended the priority areas be given to readying physicians, nurses, midwives, dentists, and pharmacists for the launch of the regime. and to consider the challenges or gaps in readiness of member states in implementing the single registration of these professionals. And with that, I conclude the presentation. Over, Chair.
Okay, thank you, Dr. Bender, for your presentation on the CARICOM Single Registration of Professional Act. I now invite any feedback or comments from the members. Dr. Cummins?
Yeah, just a question I wish to ask. And this is particularly for physicians. And I'm asking this because some physicians train, the MBBS program at University of Guyana is an accredited program, which means that the graduates can work anywhere in the Caribbean. And I know at the level of CARICOM, they've agreed on the CSME certificate. The question I wish to ask, and maybe we need to find out, if this CSME certificate is accepted by all member states. I will not mention any particular country, but I know for sure that all of the member states do not accept it. Because it was meant to be accepted. We're talking about harmonization, we're talking about recognition. And I know there have been challenges. I will not mention a particular country, but if we at the level of CARICOM, we can investigate that and have it sorted out. Thank you.
Thank you, Dr. Cummins.
Yes, Dr. Cummins. Your comment is noted, and I think that's precisely why the community continues to work on these agreements. Because I think sometimes, or rather based on my understanding, what is considered required for the practice and registration of certain categories can vary from member state to member state, and that's usually where there is some challenge in terms of transitioning one subsect to the next. And especially understanding that not all categories are regulated in the same ways within the territory. So those are some of the aspects that will come out in the consultations as it relates to the implementation of this initiative.
Thank you, Dr. Bender. Okay, we'll move on to agenda item number 11, the management of the migration of health workers, and we'll have the Dominica experience. And so I'll now invite Dominica, who would make that presentation, the representative from Dominica.
Thank you, Madam Chair, for that opportunity. The presentation should take about 6 minutes for the most, if that's okay. And it's a PowerPoint presentation, so therefore I would like to be allowed in, please. Thank you. Okay, good. Are we seeing the slide?
No, I'm not seeing it.
Is anybody seeing besides?
No, we're not seeing them.
You're not seeing them? Wow. Just a minute. That's all less than a minute, please.
Okay, PNO, you might have to click the green button, share, and then.
Oh.
Okay. Yeah, okay. You're starting to share the screen now.
Thank you.
Yes, we can see.
Okay, great. Thanks so very much. Yes. So it's the HRH management of the migration of nurses, the Dominica experience. Why the focus on nurses? Because 85% of the migration as it relates to the healthcare system in Dominica are being experienced from the nursing service unit. Brief outline, which I won't really go into. I'll give an overview, background, strategy, the problem, and the outcomes as to our actions that we have taken. Country brief overview. We are known as the nature island of the Caribbean. We are located between two French islands. We are very mountainous, heavily forested. Our language is English, but we do have French patois, which we call the Creole, because we, again, are located between two French islands. In terms of our population, we are about 72,000. We are considered a small island developing state. This was last censored in 2014. Based on observation, we may have seen a decline in that population. Another interesting fact for us as it relates to our country, we have had 3 major events of catastrophic damage from Hurricane David, Erica, and Maria. The reason why I brought this up, because it did have some form of implication as it relates to the migration of nurses in Dominica. Our service, we operated within the Ministry of Health, Wellness, and Social Services in Dominica. We are providing care within the primary and healthcare services. We are really the largest in terms of professional human resource body. The roles and responsibilities of the nurses in Dominica basically mirror their training, and based on that, they are placed in units or department based on their professional areas. The problem which we in Dominica have been or experienced over the past few years is nursing attrition, nursing shortage. This based on survey, we found out that this was due to the migration of nurses. The reason why we had nurses migration, based on the study that was done sometime in 2018 by Powell and a Canadian consultant, the key factors we found out was lack of professional opportunities within the services, lack of professional development opportunities. There were poor working conditions and insufficient remuneration. The poor working conditions more or less stemmed because of the catastrophic hurricane and disasters that we did experience in the island. What are the strategies, the investment? This is the main highlight. What have we done as a country? We did several. We had to conduct a lot of high-level meetings within the Ministry of Health in consultation with the nursing service. We had to do a lot of assessments. We had to do a lot of submission of documents, that is the nursing service. And we even had to have some form of press release to allow the public to be aware of what are some of our challenges and what were some of our requests that we were going to be proposing to the government. Thankfully, I must commend the government for their support and steadfast action as it relates to minding or looking into the affairs of the nursing service and having some quick investments done. We had decided on some, not just quick, we had some immediate actions, short-term as well as long-term measures. So over the past 6 years, we have had improvement in the working conditions. We had newly built structures and facilities. We had approval of 100% increase in allowances of the night duty, nourishment for the nurses. We also had increase in session payment rates to the nurses. We had recognized, or there was a recognition of 9 nurses for their outstanding performances. This means that the naming of the health centers were done in recognition of these nurses. And we also had this opportunity to have the approved duty-free concession and purchase of vehicles by nurses. Over the past few years, 2024 was one of our main year of achievement. I must commend again the government for that. We had great remuneration benefit. We had increased salaries of nurses. That was done due to the organizational review and reclassification of the public service. We also had increased capacity of the workforce. In 2024, we had an increase of 57 newly employed nurses plus 13 Cuban nurses. This is because of the diplomatic relation. We had 10 retired nurses, registered nurse midwives who gained 2 years contractual employment. We had secured tenure for about 78 nurses in terms of having them have their permanent appointments. This was one of the areas that we realized that caused some form of demotivation. So we worked into that area and got 78 nurses appointed to secure tenure. We also had 31 trained community health nurses who gained continuation of contract within the Ministry of Health. Moving on into our achievements, we have had policy development and advocacy. This is one of our main highlights that we have considered very critical. We had the policy document prepared. It is titled The Proposed Restructuring and Modernizing of the Nursing Service. That was developed by myself with consultation within the nursing service and even with other stakeholders. This was approved by Cabinet and it took effect January 5th, 2025. The aim of that policy document was really to facilitate retention, promote mobility within the nursing service, to enhance also remuneration, and to boost the morale and motivation of the nurses. This is the draft document, as you can see in the picture on the side. We also have lateral to that another approval document from the government as it relates to the restructuring of the nursing service, which I will get to. But just to let us know, in terms of some of the approval as it relates to the restructuring, we had some change in nomenclature of nurses. They will upgrade in positions, they will upgrade in other areas. We had creation of new positions. We had change in nomenclature, as I've said, listed before, but particularly in areas of our registered nurses. We had creation as well of support service positions, such as operating room scrub technician and aides. And also there was an increase in budgetary allocation for personnel emoluments to the Ministry of Health. Currently, this is an ongoing action process. It is taking us some form of togetherness and collaboration to get the approval implementation plan going on this. Yes, so the next policy document we got approved was the nursing service training plan to meet Dominica's need, basically to support the restructuring document that was presented and approved. We have, currently it is a live document we are working on. In spite of the approval, we were given the opportunity to make a few adjustments based on the training needs. And some of the areas we have recognized and have indicated in this document: nurse educator, nurse manager, direct entry registered nurses, midwifery, among other programs. We have in total about 32 new programs approved in that document. Yes, another area of achievement is in relation to governance and legislation. We have had great advancement in the review of our nursing professional bill, which also assists and support those policy documents. So at this stage, we are soon to present this document in Parliament and have it enacted. We also have had collaboration and networking with representation from participation from even meetings like these, which has been very much supportive and has been a means of motivation for us to have in terms of improvement in our HRH nursing personnel. We have worked collaboratively with PAHO in improving the nursing education position. We have had mission conducted with PAHO, who assessed and assisted in having a review done of the nursing education institution here in Dominica. Yes. The value and impact of those actions, I must say, it has allowed for upward mobility within the nursing service. We have had staff motivation. We have had increase in the nursing service workforce capacity. We have also have had marked increase in the nursing management positions. We have seen some level of retention of the nurses. We have seen a significant decrease in resignation and migration in nurses. 2024, there were 21 resignation. In 2023, we had 9 resignation. And to date, from January to now, we have not had any resignation from nurses. So we commend ourselves on that. As it relates to insights and lessons learned, in relation to our achievements, I must say though, one of the lessons, or not only learn, but we are also continuously are learning within the nursing service, the policy and advocacy. We realize that there is a growing need and recognition for us in the nursing service to be engaged in policy formulation and be able to advocate for these policies development. We see a growth in our leadership skills as it relates to policy and advocacy. We have also learned that in terms of those achievements, we have had workforce development. We have seen an enhancement in our nursing education and training, and we continue to support and look forward to improving in terms of our training capacity. We have seen enhanced collaboration, working together as a nursing body and also having stakeholders who are very supportive to us. That has also enhanced our collaboration. We also realized too, this working together and having those form of achievements have improved in the quality of the delivery of nursing care. And that has also given us some form of assurance that we have the opportunity to review documents that speak to quality assurance and standards as it relates to nursing. So right now I am in the process of preparing another policy document as it relates to quality of care to the public in relation to the nursing service. And finally, it has allowed us to have some form of sustainability and resilience in the healthcare system. Thank you so very much. That concludes my presentation.
Thank you very much, Dominica Tirile-Ravinier, for your presentation and the meeting note the achievements that you've made in terms of improving and strengthening the nursing workforce in Dominica. I'm just going to quickly ask the meeting if there are any comments that you would like to make briefly, as we are mindful of the time. If not, I'll move on straight to the next presentation, which has to do with updates on the outcomes of the high-level meeting on the migration and mobility of health workers in the region of the Americas. And this presentation will be made by PAHO WHO. I see chair of the HRH commission as well. So Dr. Bolastic, you'll provide an overview of the outcome of the high-level meeting on the migration and mobility.
Right. Thank you very much. Are you seeing the
yes
screen?
Yes,
Okay.
yes.
Just wanted to before I proceed, just wanted to commend the previous presenter, PNO Revalier, for outstanding work in Dominica. And it shows you how a comprehensive approach to HRH strengthening really, helps countries achieve the desired outcomes that it wanted to accomplish. So I think that was a very good demonstration of how to be able to connect the dots in terms of strengthening not just HRH, but the whole health system as well, and looking at the various components to to make the HRH much stronger. And so with that, I would like to proceed with my presentation. And this has to do with just the summary of the strategic orientations that came out of the high-level meeting on migration and mobility of healthcare workers in the region of the Americas. This was organized by PAHO and WHO Europe, the regional office of WHO in Europe, with participants from Barbados, Brazil, Canada, Chile, Ecuador, Germany, Grenada, Guyana, Honduras, Ireland, Jamaica, Paraguay, Portugal, Spain, and the United States, with experts from the World Bank, Inter-American Development Bank, ILO, and IOM. So this has been a very successful meeting that actually brought together both the source countries and the destination countries and have a very meaningful interaction between the two. And we're very happy that the Caribbean voices were actually heard with the representation from the 4 countries from the region. So moving on. Okay. All right. So the objective of the strategic orientation is to improve the governance and management of health worker migration and mobility in the region, focusing on maximizing benefits, minimizing negative impacts, ensuring ethical recruitment, and strengthening health systems and in both source and destination countries. Oops, sorry. So the framework, these are the documents that were considered in the development of the strategic orientations. And you will see here, it includes the WHO Global Code of Practice, the Workforce 2030 Policy, the Policy and Health Workforce from PAHO, the Bucharest Declaration, the Global Compact, ILO's Fair Recruitment Initiative, bilateral agreements, and also contributions from experiences from both PAHO and Euro countries. Sorry, I'm having problems with the... Okay, let me just exit the full screen so I'd be able to move it better. Right. So what are the strategic orientations proposed? One is ethical recruitment and fair treatment of migrant health workers. The strengthening of HRH planning in both source and destination countries, strengthening the health workforce to achieve resilient health systems, facilitating circular migration, or what we call the return migration, and regional collaboration and policy coherence that are focused on shared responsibilities and are reflective of a collective commitment. In terms of ethical recruitment and fair treatment of migrant health workers, the objective is to encourage countries to commit to health worker recruitment practices that are adherent to principles of ethical recruitment, the promotion of fairness and transparency between source and destination countries. So some of the key actions here includes adherence to the WHO Global Code of Practice and also compliance with the reporting processes, engagement between source and destination countries, applying the code's objectives and articles on ethical recruitment, implementation of mechanisms to improve legal and institutional framework for international recruitment to guarantee equal treatment for health workers, to include legal protections and gender-specific needs and gaps. And second is to prioritize strengthening HRH planning in both source and destination countries with the objective of strengthening workforce planning through the comprehensive HRH information systems and implementation of the National Health Workforce Accounts for improved decision-making. The key actions involve strengthening the HRH information systems and National Health Workforce Accounts, looking at their mobility and migration to support evidence-based workforce planning, the conduct of HLMA, as we mentioned earlier, as a tool to guide policy interventions and to carry out capacity building initiatives of national health teams. And third is the strengthening of the health workforce to achieve resilient health systems with the objective of developing and implementing collaborative frameworks to bolster health systems based on primary health care that focuses on retention and capacity building to mitigate the negative impacts of migration. The key actions involve sharing of best practices, establishing mechanisms to monitor, evaluate, and disseminate information on the health workforce, establishing bilateral agreements within source and destination countries, and supporting member states and relevant stakeholders in the next generation of bilateral labor agreements. Other key actions include adoption of policies to improve working conditions and inspire and attract young people to pursue careers in healthcare. Fourth is facilitating circular migration with the objective of exploring and documenting evidence and examples of circular or return migration of health workers, with a key action of promoting operational research to collect and share evidence on circular migration with mutual benefits for both source and destination countries. And finally, for regional collaboration and policy coherence, the objective is to strengthen collaboration across the Americas and European and other regions to promote the uptake of the code and the coherent and harmonized policies, supporting sustainable health workforce mobility and addressing the shared challenges of migration, with the key actions that include ensuring engagement of the WHO governing bodies relating to the code of practice, aligning HRH national policies with migration-relevant global frameworks, fostering regional and interregional operation through collaborative policy development, and organizing regular multilateral policy dialogues among countries in the region. We also would like to draw lessons from pertinent initiatives like the Bucharest Declaration and promoting social dialogue among health, labor, and education sectors, including workers' organization. And so the way forward is that the strategic orientations propose a framework to collaboratively address health workers' migration and mobility challenges in source and destination countries with the support of PAHO, WHO, and other strategic partners to translate these orientations into a practical roadmap. So there's going to be another regional forum that is going to be organized, and we hope that the voice of the Caribbean will remain to be heard in these policy dialogues. Thank you very much, and over to you, Madam Chair.
Thank you, Dr. Bulastik, and we note those priority areas, orientation, as you call it, that are of priority coming out from that high-level meeting on migration and mobility in the region of the Americas. Are there any feedback from the member state?
Perhaps, Madam Chair, you would like to share your experience having been part of
Yes.
the
Okay, well, yes, I attended that meeting, and the discussions that came out from that meeting was very rich. A lot of emphasis were placed on bilateral agreements, establishing bilateral agreements between the source and the destination countries, so that the source country at least gets something from the destination country in terms of developing its human resources for health. The circular migration one was also recommended in terms of, allowing, our HR to migrate abroad for a limited specific time, and when they return, they would come with additional skills that they can share and implement in their own country. So I think the orientations, we can look at it, and see how best, we can implement them. The code, while it's not legally binding, but if we can get adherence to the code, we think that would help us a lot, in terms of retaining some of our human resources at home. All right, so we're coming to the end. I think we are at we didn't have any other business. The date of the next meeting. The proposed date is Wednesday, the 11th of June, 2025. That's the proposed date for the next meeting of the Human Resources for Health Commission. I now put forward for any objections or to that date, the 11th of June. Remember, we are having quarterly meetings. So if no objection, we would have the next meeting due Wednesday, 11 June 2025.
Chair, if I may?
Yes.
Yes, so noting that meeting date has been set, I'd like to know if the meeting would be interested in extending it beyond the usual time. I note that we went a little bit beyond the 2-hour mark. Could we consider doing 2.5 to 3 hours instead for the next meeting?
Yeah, I see. Paho, thumbs up?
Yes, I'm in agreement, but of course it's up to the the members of the HRH Caribbean Commission to agree to it.
All right. So yes, well, in that case, what we would extend as a proposal would be, let's say, 2.5 hours. Again, subject to tentative changes based on the guidance and the membership. But noting that we do have I see there is a hand up from Ms. Revelier.
Yes, Ms. Revelier, you may proceed.
Sorry, that's a hand of agreement because sometimes
okay.
it feels
Okay, will do. But I just wanted to bring to your attention, Chair, that we are currently correct. Member states did join it during the course of the meeting. And as such, I note while we did not have the chance due to the time constraint of the meeting to have meaningful feedback on all decisions that were put forward, we will make a very strong attempt to produce the decisions of the meeting for the membership to confirm. Because again, moving forward in terms of operationalizing the action points of this meeting, we would need the confirmation from the membership in order to take next steps. So we'll try to turn that over as soon as possible for the membership to consider.
Thank you, Dr. Bender. Okay, and if there are no final comments from anyone, I would just like to take the opportunity to thank you for attending this meeting and for your contributions to this meeting. The recommendation for an extended time, given the agenda items and the way we had to rush it, is being considered. You know, I would say maybe a 9 to 12 start. I don't know if that start 9 a.m., finish at 12. But we look forward to getting the decisions coming out from this meeting and for consensus. So thank you again and have a good afternoon.
Thank you, Madam Chair, and thank you all members.
Thank you. Bye-bye.
Thank you, Madam Chair. Good job. And we'll see, and we look forward to your feedback on the documents and as well as feedback on the action points. Thank you all.
Thank you. Bye-bye.
Thank you. Bye-bye.